My name's Ryan. I'm a professor at Georgetown University, and also I co-founded 2 organizations that work to support the well-being of children and parents. As a result of that latter work, I've had hundreds of conversations with people who've been negatively impacted by circumcision. And so I want to share some of their voices with you because I think their voices are not being heard in the mainstream discourse around the subject. Well, first, I want to just understand a little bit more about where we're all starting. So I'm going to use this very ancient technology called room polling. I'm going to make this wall over here be you think this is harmful, this wall, the ceiling here be you think something is neutral, and this wall be you think something is beneficial. I'm going to ask you, what do you think of, say, foot binding? So I think, for example, that it's harmful. Okay, looks like we have ubiquitous agreement around that. What do you think of female genital cutting, which we often have a lot of discourse and concern about? We have one person with a little bit up. Okay, what do you think of prophylactic breast bud removal? We could wipe out breast cancer if we were to prophylactically remove the breast buds of all infant girls. Okay, harmful. I'm glad to see that most of us don't think it's harmful. Okay, what about cutting off non-essential skin from a child? Say that you thought that your child would look better if they didn't have earlobes, which to my knowledge have no known function. Harmful, neutral? Okay, those willing to vote said they feel like it's harmful. Okay, so what about circumcision, this common procedure in the United States? How does everyone feel about it? I've got actually mostly sort of the neutral to harmful range. Okay, and maybe a little bit of harmless. Thank you for taking part in that. So I'm going to share with you some perspectives that dissent from our cultural normative view in this country, which is that circumcision is either good or neutral. And as a warning, there are a couple slides, only a couple, and a short video that may be uncomfortable to watch. It's okay if you want to turn your head at any time. But most of the talk, I hope, will not be too unpleasant. So first of all, circumcision, the child's point of view. This is the point of view that I think is the most missing from the discourse, and that's because, it's done to infants and they don't have the ability to speak. So I'm going to have to try and represent that myself. About 1 million children are circumcised in the United States each year. In the surgical procedure, we take a brand new child, a newborn, whose genital area looks like that. We strap the child to a board called a circumstrate. We cut off the foreskin, which is part of the penile skin system, and the result is a penis that looks like that. Michelle Storms, a family practitioner who stopped performing circumcisions because she decided to conscientiously object in 1988, says anyone who wants to have this done to their child should see one. I want you to try and watch and listen to the child's perspective.
No, that just crimps the whole thing.
Use some anesthetic.
What's that?
As a way that you would use some anesthetic. Okay, no problem.
Got himself upset.
What I heard is a baby crying in a way that I don't usually hear a baby crying. I heard pretty severe distress. And I think that it's important to notice that the baby is saying, no, please don't do this to me. Another important thing that we don't talk about much is what are we actually removing from the child? This information is missing from all the medical texts that I've looked at. The foreskin is actually the most sensitive part of the male body. It has the densest cluster of nerve endings, about 10 to 20,000. And in an adult, it grows to be to cover an area of 12 to 15 square inches. It has several important functions, some of which are relevant for the baby, like it protects the penis from diaper, feces, abrasion, things like that. And some of them important later, like the skin mobility, a contribution to lubrication during sexual activity, and of course the sensation that I spoke of. No one actually knows what the risks of circumcision are, because no one tracks them and they're very difficult to track. But we do know that it has some potentially very severe complications. In panel A, what's been caused is a fistula. That black line is a probe that's extending into the meatus and out the extra opening of the urethra that's been caused in that child. In B, there was a near amputation of the head of the penis. C is a condition called a buried penis, where all of the shaft skin was removed, so the penis now resides inside the scrotum. And in D, that's an amputation of the entire penile body. The hole there is the urethra. E and F are one of the most common end results of circumcision. In improper healing, it's called a skin bridge, when the skin heals, in healing, joins the glands to the, or creates an extra joinment to what's left of the inner mucosa. Like I said, nobody knows what the complications are, but you can go and talk to pediatric urologists and ask them, well, how many complications do you see? And so David Gibbons, who's at my institution, said in 2 years he saw over 275 newborns or toddlers who had circumcision at the newborn period and had complications severe enough for them to come see him. About half of those required an additional corrective surgery. So I'm arguing that the child's perspective is that this is a lot of potential harm that we're subjecting the child to. And that we don't know, what we do know is that infancy is a very important time in attachment. And we don't know the effect that has on attachment. So now I want to move over to the perspective of the men. So there are some men who say they wish they hadn't been circumcised. There's I found this, most of the men I've talked to who say they wish they hadn't been circumcised tell me, I've never told this to anyone. And so I found this, I thought it was very compelling. There are all these men who had their pictures taken to put them together to say they did not consent to the procedure. So they're saying that they wish that hadn't been done to them. People have said things like, I can't accept someone did that to me. It's like I've been raped. It has negatively impacted all of my relationships. As I said, some men don't speak to anyone. When I was working on another project with a woman who I'm not going to name, she found out about this work I do, and she confided in me, my husband won't tell this to anyone, but his circumcision was botched so badly that we can't have intercourse. We have to find some other way to engage in sexual activity. One of the reasons men complain about it is that they believe that the foreskin is the most sensitive part of the penile skin system. This study in 2007 backs up that perception. They used a microfiber touch test, and they found that the most sensitive regions, which are this maroon color, and the second most sensitive regions, which are this purple color, are all in the foreskin area, the area that's amputated. This is Dustin. He's a gay man in relationship who's circumcised in relationship with an intact fellow, and he says that he can tell that his experience is significantly less than that of his partner.
I feel such a sense of loss, knowing exactly what it is that was taken from me, and I don't know. Sometimes it's best not to really focus on. I mean, it's obvious. I mean, I'm a male and I'm 30, and my penis doesn't function like it's supposed to, and that's a tremendous injustice. Really, it really is.
So if you try to survey men who are circumcised and feel it was bad for them, which one group has done with an online survey, you might get results like this. 75% saying that they feel less whole, 74% saying they feel damaged, 73% saying my human rights were violated, and so on. Again, these people who self-identify as having been harmed by the process. If you live in a society like ours that circumcises almost all of its newborn men, you may have never seen a foreskin or understand actually what it does. So this is what you might be more familiar with, a circumcised penis. And what some men I talk with don't know is that they have a scar. They don't know that ring is actually the scar from the circumcision. What Mr. Erickson has done here is taken photographs of a foreskin during a retraction. So all he's done is made these two lines so that you can see as the foreskin retracts how much tissue it is. And you can tell the difference between the external parts, which are not mucosa, and the internal parts, which are mucosa, which are soft, they're kept moist, and they're kept protected by the outer parts. So moving on in this whirlwind tour to the parents' perspective, I've talked with quite a few parents who have significant emotional consequences of having made that choice, because they often don't understand what they're getting into. When they get the baby back and see the wound, and maybe then go on the internet and look, that's when they understand the procedure that they said yes to. There have been no studies of parental regret, but you can hear things like, I was shaking and I muttered, "Oh God, what have I done?" Some people who are actually present for the circumcision saying things like, "I will die hearing my baby screams." And some people saying, "I didn't do what was right for my son." Here's a father.
So you're a father that is circumcised with an intact son and a circumcised son.
Yes.
Do you foresee any problems with that, or have you had any problems with that, or what's your experience?
The only problem that I foresee with it is the apology that I'm going to have to give my oldest son. Of course, I could go on and say that, furthermore, the only thing wrong with it is I didn't do what was right for my first son. And then, if you delve into it deeper, that wasn't done right for me either.
And I argue that parents don't receive a fair shake at informed consent. But the kind of material that's out there on, websites like my university hospital's websites ignores the anatomy that I've just shown you. It minimizes the complications, and it doesn't mention anything concerning about the ethics of choosing optional surgeries for your newborn. And again, as I said, parents don't often know ahead of time that what they're opting into is this painful wound on their child that's going to take 7 to 10 days to heal, that they have to keep an eye on for infection or other problems. Whereas, without a circumcision, there's no additional care required. This is Lisa Masterson, a semi-famous obstetrician from this TV show, The Doctors, being interviewed on The Late Late Show.
Yeah, and again, but that's a personal choice. And I talk to my patients as an obstetrician. I talk to my patients a lot about this. And really, there's a lot of health benefits and some risk benefits, but it's really a social procedure. So you really have to decide, do you want your son to look like you? Do you, is it a cultural thing? Is it a social thing? It's absolutely, and there's some health benefits, more for the lady than the man, but as far as decreasing STDs and passing on to, other women, and HPV, which can cause cervical cancer, so decreasing STDs and cancers, all that good stuff.
But couldn't you achieve the same effect by washing your pee-pee on a regular basis?
You absolutely could. And
So we're talking, you can have this chopped off or you can wash it. Your call.
Exactly.
It's a tough choice there, Doctor. I know.
So all of those supposed benefits, I think, are a smokescreen for the real issue. Right? They're all contended in the medical literature. And what you heard her say is that it's a social choice. Right? So why are physicians offering people a social surgery for their child and posing them this question, this choice they don't need to be burdened with? What do you want your son's penis to look like? Here's James Snyder.
Because it's not therapeutic. But in any case, it's in search of a rationale. I mean, we're trying to find a reason to do this. And
to what you heard James say, hopefully, is that it's in search of a rationale. We've been making up reasons for it for the last 150 years, since we introduced it to medicine during the Victorian ethics era as a cure for masturbation. Look at the history. That's what it was introduced to physicians' practices for. This is Tora Spigner, a nurse.
And this baby is screaming, and it's like practically choking now. And my heart went out to this poor child. So I said, why is this being done? So that's when I kind of had to excuse myself, because I felt physically ill. I had to leave.
For an outside perspective, here's Soraya Murray. She's from Somalia. She was subjected to a very significant form of female genital cutting.
I am Soraya Murray. I'm from Somalia originally, living in Los Angeles. I'm a human rights activist. The thing that really shocked me when I came to America was the reaction I got when people find out what was happening in Somalia, Sudan, Ethiopia, those parts of the world, Egypt, about female genital mutilations, and people were horrified, they were shocked, they were angered. It was not even a feminist standpoint, but it was the rights of the child, taking her humanity and integrity. But behind closed doors, they were mutilating their own young, boys, sons. And it's everyday ritual here, but people don't see it as a ritual. But to me, I would see it as ritual because it's the same thing.
So I offer these voices to you because I believe that they indict circumcision as an ethical problem. And when I talk to people who are in power around this issue, obstetricians who are performing it, they tell me why they can't stop. When I talk to bioethicists, they tell me why it's not safe for them to talk about it. So my challenge for you is, if this conference really does have an aspect of moral courage to it, are you going to talk about it?